Have you ever gone to the pharmacy before and got your flu shot? Have you ever run out of refills on your prescription and the pharmacist was able to extend an additional refill? Have you ever seen your pharmacist for a minor ailment like a bladder infection and they wrote you a prescription? And when you received those services, the only thing you would have had to pay for would be the cost of the medications you received after your insurance. While there are several services that pharmacists provide absolutely free, receive no compensation for, those types of services that I listed earlier are actually paid for with your taxpayer dollars. Obviously, the situation may be different from state to state or province to province, but here in Alberta, those types of services are paid for by the Alberta government. Today, I'm going to show you a breakdown of what services cost what, and I'd like to hear from you guys. Do you think it's reasonable? Do you think it's too low? It should be higher? Let me know. Referencing the Alberta Blue Cross's Pharmacist's Guide to Pharmacy Services Compensation document. And this isn't hidden information. You can find it. You just probably wouldn't know what to look for. So even Googling CACP RXA 1, 2, 3, 4, 5, it's the fifth document down. So this is public. Anybody can take a look at this. Extending a prescription when you've run out of refills, $20. If you bring in a new prescription that needs to be modified for whatever reason, be it the dose is wrong or the directions are wrong or something needs to be changed so that it's safe for you, $20. Modifying an insulin prescription, specifically insulin, $20. Getting an initial access prescription from the pharmacist, meaning you've never been on this med before, you didn't see the doctor, you saw the pharmacist, they did an assessment and they prescribed medication for you, $25. Prescribing a medication in an emergency situation, $20. Renewing your prescription in the event of a declaration of a state of emergency or declaration of a state of local emergency, $20. Refusal to fill a prescription. This one's very interesting. If there is any concern for medication misuse or abuse or even falsifying a prescription, a forgery, if you will, do not fake prescriptions. The pharmacist can refuse to fill that prescription and gets paid $20. Assessment for a trial prescription. To be honest, I really don't see this one very much. It could fit into other categories. Again, $20. Assessment for the administration of a product by injection. So any product that's covered by the government, be it like a flu shot or RSV or pneumococcal, $20. Without overcomplicating this video, there are technically two different types of medication reviews in Alberta that the government will cover for. So there's the CACP, which is the more complex one, and the SMMA, which is the less complex one. Basically, it's decided which one's which by having a certain number of chronic diseases and a certain number of risk factors. So for the CACP, it is $70, and you can do that once per year. And you can have up to 4 follow-ups per year, $20 each. And the SMMA is $60 once per year. And the follow-ups are the same, 4 follow-ups per year, $20. Interesting fact here in Alberta, the Alberta Pharmacists Association actually met up to talk with the government on several occasions, warning we have a influx of people moving to Alberta. We have a rapidly aging population. We're going to need more funds to adequately serve all these patients. And essentially what the government ended up doing is keeping our budget the exact same, but just had the reimbursement for the services we provide be less. So that CACP used to be $100, and you used to be able to do up to 12 follow-ups for $20 each. And now they've cut it down to the 70 and 20 times 4. I'm curious to hear what you guys would think. What would you value some of these services to be? Are there different services you'd like to see from the pharmacy be covered with your taxpayer dollars? Thanks for watching. Follow for more.